Footage shows mask-wearing crowds piling into an overwhelmed Beijing hospital amid fears over mystery pneumonia sweeping country, but China insists flu and usual winter bugs are to blame, not a new virus. Beijing has called for more people to get vaccinated amid the wave of infections. Read more. We need to keep an open mind about the cause, UK health chiefs. Alarming footage shows mask-wearing crowds inside a Chinese hospital amid fears over a mystery pneumonia sweeping the country. Beijing insists a new virus is not to blame for scenes of chaos, which have prompted officials to encourage residents to don coverings, socially distance and stay home if unwell. Instead, the surge in cases has been attributed by health authorities to influenza and other common illnesses. China is currently facing its inaugural full winter season without a COVID-induced lockdown. Reports from local media depict health facilities as being inundated with unwell children. Despite this surge, China's health ministry has assured the public that it has the capacity to manage the increased number of illnesses, alleviating concerns raised globally following the recent news outbreak. The situation prompted the World Health Organization (WHO) to make an uncommon public request for additional information from Beijing regarding these infections. Observers pointed out the similarity between this wave of sickness and the reports that surfaced just before the onset of COVID, prompting accusations against China for concealing crucial information at that time. In a fresh statement on Sunday, the country's health ministry claimed the surge in cases was caused by the flu and other known pathogens. It ruled out a novel virus, like the one which sparked COVID after triggering its own mystery pneumonia wave in December 2019. A National Health Commission spokesperson said the recent clusters of respiratory infections are caused by an overlap of common viruses like flu and RSV, as well as bacteria such as Mycoplasma pneumoniae. They added the ministry has called upon local authorities to open more fever clinics and to promote vaccine uptake among children and the elderly. Efforts should be made to increase the opening of relevant clinics and treatment areas, extend service hours and increase the supply of medicines, said ministry spokesman Mi Feng. He also advised people to wear masks and called on local authorities to focus on preventing the spread of illnesses in crowded places such as schools and nursing homes. Chinese health authorities have blamed the surge in winter bugs hitting the nation harder due to lowered immunity in the population as the nation faces its first full winter without COVID pandemic restrictions. Beijing only began loosening its strict nationwide, zero COVID policies in December last year after mass protests that saw people calling on Xi Jinping to step down. Independent experts have backed up China's claim the surge is linked to lowered immunity, as other nations, including the US and UK, experienced similar post-lockdown waves of illness. However, alternate viewpoints, including the UK Health Security Agency, advocate maintaining an open mind about the origins of the enigmatic pneumonia. Many have drawn parallels to Beijing's lack of transparency during the initial stages of the COVID-19 pandemic. Initially, both COVID-19 and another pandemic virus known as SARS were identified as atypical forms of pneumonia. Following a teleconference, the WHO confirmed that Chinese health authorities provided the requested data on Thursday. The data indicated a rise in pediatric hospital admissions due to various illnesses, including bacterial infections, RSV, influenza, and common cold viruses since October. Despite the surge in patients, Chinese officials assured the WHO that hospitals in the country had not reached their capacity. Notwithstanding these assurances, images circulating on Chinese social media platforms depicted overwhelmed hospital waiting areas crowded with parents and children. Reports from local media highlighted overwhelmed hospitals in Beijing and Liaoning, about 500 miles northeast, flooded with sick children exhibiting unusual symptoms such as lung inflammation and high fever without a cough. FTV News from Taiwan echoed similar concerns about overwhelmed hospitals, with parents questioning potential cover-ups by authorities. While newly released footage confirmed the strain on hospitals, the precise filming date remains unknown. The WHO's public request for additional information is atypical, usually occurring through private channels. It sought more data from China via an international legal mechanism. Internal accounts from China describe outbreaks overwhelming hospitals in northern regions, prompting health authorities to advise utilizing clinics for children with less severe symptoms. The WHO indicated insufficient information presently available to accurately assess the risk posed by these reported respiratory illnesses in children. However, A WHO official remarked that the current wave of cases is not as substantial as the pre-COVID period experienced by China and the world.